Good afternoon, everybody. Welcome to our webinar, how advanced analytics can help reduce denials and improve revenue. Today's agenda, we're going to go through some housekeeping, give some introductions. We'll talk a little bit about something that I assume everybody is here to learn a little bit more about as well, which is the impact of claims denials, and then shift the conversation directly over to Lisa Ness from Virginia Mason, and Lisa will walk us through a very compelling case study based on her experience with DenialsIQ at Virginia Mason. We will follow that with a live demo of the product that Claire is going to give us of DenialsIQ, and we should have some time left over at the end for Q&A. So it would be great if throughout the course of today's webinar, you could enter your questions right in the chat window over to the right. Okay, for the fun stuff, housekeeping. We're going to run 45 to 50 minutes, so that should leave us, as I said, some time for Q&A at the end. You do have access to these slides. You can download them right now from the webinar platform, or they will also be made available to you following today's webinar through our follow-up communications. Please ask questions. You know, we want to hear from you. We want to engage. We will do our best to get to those questions, and if we don't, then we will follow up. But we really encourage everybody to be active, submit your questions, and we will do our best to get to them. So the fun doesn't end today. We have a lot coming up, a lot of exciting events on the horizon, including MGMA, which is October 8th in sunny Anaheim, and then followed by CHUG, which is the Centricity Health User Group, October 26th in New Orleans. So certainly hope that we get a chance to see some of the audience here today at either one of those events. And what a great opportunity that would be for us to continue this dialogue, and we hope that you will, like I said, come see us at those events. So today's speakers will do some brief intros leading into each speaker's section. So I'll go first. My name is Andrew Slotnick. I'm the Director of Product Marketing for our Applied Intelligence business. That's our healthcare analytics business. And so I've been very much involved with the maturity, the launch of DenialsIQ, worked very closely with customers, and have worked very closely with our two esteemed guests here today, Lisa Ness from Virginia Mason and Claire Wright, who I will ask to give introductions of themselves at the beginning of their section. So I'm going to kick us off. We're going to do about 5, maybe 10 minutes on industry trends and claims denials. And look, my guess is that everybody on the line here shares a common pain, or at least a belief that claims denials are not our favorite topic. But there's good news here, because while we know that we're all operating in an extremely tense environment where pressure to compete has really never been greater, denials actually, as much of a pain in the rear as they are, represent a great opportunity as well. So at a very high level, denials and claims processing is one of the most costly drivers of waste in the healthcare system, driving $210 billion a year in waste. And about 61% of those errors are due to technical or demographic errors. Now, those are things that we can fix. So again, we immediately go from negative to positive here. And if you're concerned that maybe you are performing above your peers, maybe you're a top performer in the category of denials, that's a good thing. But we still believe that there's opportunity for you to improve as well. And this statistic from the advisory board supports that. So what we see here is that 17 to 27% of denials are never recovered, even by top performers. So even if your denial rate is in that single digit, 3, 4, 5, 6%, there's still opportunity for you to leverage advanced analytics such as DenialsIQ to have meaningful impact on your revenue performance. So why are analytics, why is this a great tool for what we're trying to accomplish here? Because when applied to specific business challenges, Analytics can provide very actionable insights, and this area of revenue cycle has many of those opportunities. There are a couple big ones listed here: cost to collect, debt, quality, revenue, acceleration, velocity, and then time spent. So these are all challenges that we face within the revenue cycle and that denials have a big impact on. So naturally, there's data coming at us from many different areas in the revenue cycle, whether those, it's from the payers, whether it's from your providers, certainly the wealth of data being generated by the various categories of denials. Really, the magic here happens when you target the outcomes that you're trying to drive. So you narrow down on a specific business challenge, and then you assign those KPIs and the outcomes that you're trying to drive to. That's what makes this such a great opportunity for the application of advanced analytics and DenialsIQ. And we think we know a thing or two about what it takes at GE because we've been doing this for a long time. So deep insights. Obviously, insight across workflows is really important. I think we're going to hear Lisa talk a lot about that, but visibility into the data, into the workflows, enterprise-wide is super important. The cutting-edge tools, that's what's going to get you to the next level, and then strong partnership. Look, there's some things that you might need help with, whether that's accelerating your team's time to value with the advanced analytic, maybe it's workflow, whatever. But knowing that you have that strong partnership, especially from a service, a workflow, and a change management perspective, is really valuable as well. So in the area of denials, to me, this is sort of the perfect way to begin our transition into Lisa. But I talked a little bit here in the intro about why denial is a great opportunity for advanced analytics, and I sort of the undercurrent here is focus. You have to focus on the business challenge, and then you have to tie that to a KPI or an outcome that matters to your organization. We've been in the market now with DenialsIQ for about 18 months. So these are the 4 categories in which we think you can have an immediate impact. So back to the title of the webinar. We think that by focusing on these 4 categories out of the gate, you can have an immediate impact on revenue. We're going to hear a little bit more from Lisa when I hand it over to Lisa. But if you look at these 4 categories, eligibility, prior coding, and timely filing, it's affecting us in 2 ways. Number one, those initial denials. So every time a denial comes back, the number is about $25 per claim to rework. So that's a cost to your system. So every time there's an initial denial, that's a cost. But then on the right, these denial write-offs, that's money, that's revenue that you're never going to get back. So we start thinking about cost and revenue, and that's really where you can see a great impact with deeper insight from advanced analytics like DenialsIQ. And nobody tells that story better than Lisa, so I'm not going to go too much further on this one, but these are huge drivers. So when you talk about outcomes, you talk about business challenges, these represent immediate opportunity to help reduce costs, help improve and accelerate revenue, and then improve your workflows as well so they don't happen again and again and again. So maybe it's coaching, training, etc. But this is what I mean when I say direct, specific, targeted outcomes. So before I hand it over to Lisa, just to maybe address some of those questions up front that you might be having. DenialsIQ is an advanced analytics solution. Obviously, it leverages EDI, so 835 and 837, as well as some revenue cycle data to analyze root cause factors of denied claims. So again, it's going to help you reduce the cost of rework, as well as improving revenue collections. DenialsIQ is an advanced analytic tool. It is not a claims processing engine, so you do not resubmit claims through DenialsIQ. That's a common one that we get. There's a single version of DenialsIQ for all of our Centricity revenue cycle systems. So, you're going to hear in a second hear from Lisa at Virginia Mason. Even if you're not using the same revenue cycle system, that's okay. The outcomes still apply to you. And then lastly, DenialsIQ is a software as a service application. So in terms of setup, it means that it doesn't require any specific hardware or come with any big upfront installation costs. So those are a couple that we get frequently. If you have more questions, as I said at the top, about the application or for Lisa, please enter them into the chat window to the right-hand side of your screen. We'll catch those as they come in, and I will share them with Lisa at the end of her section before Claire. So with all that fun stuff being said, Lisa, if you're out there, I'd like to turn the presentation over to you.
Yes, thank you, Andrew. Good morning, or I guess it's good morning for me, but good afternoon, everyone. My name is Lisa Ness, and I am a manager in the revenue cycle at Virginia Mason. We have a revenue cycle of about $2 billion in gross revenue annually for our 470 physicians and our integrated medical center. And maybe unlike everyone else, I love to talk about denials, but more importantly, how to improve them and how to stop them from happening. And we were able to improve our monthly performance over $2 million. And I'm going to talk a little bit about how we've been able to do that with the help of DenialsIQ. Back in 2015, business was as usual, but we were leaking. So I like to call our revenue cycle the revenue stream. And when we get defects, that's oil in our revenue stream. And we have to spend a lot of money cleaning it out. And in 2015, we knew we had some issues, and we didn't really have a lot of reporting that could help us get to find that the issues or the oil in our revenue stream. And really it was dependent on our end users to report trends, and we were unable to quantify specific denials. So because we were dependent on our users, we didn't really know if it was a specific CPT code, maybe it was a specific service line, or a specific denial category. And sometimes, worst case, we would hear about the defects from other teams or our patients. What we did know is that our financial performance was slowing, our buckets of denials were overflowing, and our volume was too much for our team to handle. And we needed more complete information and visibility into the problems that we were trying to solve. What we thought we knew was that process really wasn't the problem. Our payers' data and biller performance was only specific to each payer, so we didn't see the trend lines across the organization. We could influence provider, patient access, and biller behavior without deeper, more specific insights into performance, and we really did try. For example, coding a certain way and trying to provide that individual feedback to providers, or providers doing additional services or non-covered services, but not having the insight to exactly what was occurring. We knew we needed to take some action. We needed to help get that oil out of our revenue stream. Some things that we considered were, other vendors, but they usually were some bolt-on, or time to value was so slow that it really didn't feel like it was worth the effort. We have an in-house analytics team, and they use business intelligence reports, but they really lacked the expertise to help us. And conflicting priorities were kind of a big problem. They were really focused on helping the clinics with data. We also considered consultants and have brought consultants in. And again, time to value, not there, and they are really priced too high. In DenialsIQ, I love the dashboard. So I have insight to an overview of everything in the revenue cycle, as well as different categories, denial categories, and our top denied providers. That was big because, again, it was a manual tracking before, and now I could actually see who was the top denied provider, and I was quite surprised. DenialsIQ really has helped us get to the root cause. And what we thought we knew wasn't necessarily the case. We thought that our biggest denial was no authorization or a medical necessity, but it turned out that it was really eligibility and documentation denials that were sinking our revenue cycle. And in this phase, it became super clear how valuable simply knowing about and clearly seeing this kind of data really was. And furthermore, we have a clear line of sight to the size of the problem. Visibility is key. And now we know what holes to fix first, and then we don't have to rediscover them again later, because we can track and trend over time. And having visibility has really made investing additional time worth it. My favorite part, stopping the oil. So we knew what the problems were, but how are we going to stop them? Well, the insights in DenialsIQ really helped us see where we should focus our efforts first. And some of those were pretty simple things, like some transaction edits on our claims and updating some eligibility on payers that we weren't sending eligibility checks on. And while they seemed simple, we didn't have insight to see where they were happening or what providers or what payers. And so we started with some simple things first. Then we started creating organizational awareness. Having these dashboards within DenialsIQ, they're really easy to get exported out into an email and share across the revenue cycle. I'm now sharing it across other stakeholders that never thought they had a part of the revenue cycle, but they really do. And so having visibility has really helped gain buy-in across my organization. And another thing is workflow improvement. So again, as I said, the people that didn't think they had any part in the revenue cycle really do, including help from our patient access teams and our coding and documentation teams. You know, they're working hard every day to prevent things from happening, but they don't see the outcome. And so now being able to show them in DenialsIQ what the outcome is, they can help us do process redesign, and now we can monitor that the fix is actually working. This is my favorite thing that has come out of DenialsIQ for my organization. As I said, we created some early on technical fixes, but eligibility is still a problem for us. And I kept saying, we've got to fix eligibility, we've got to fix eligibility, and showing them the impact, the financial impact over time in DenialsIQ, we were able to hold a process improvement workshop across the organization with multiple stakeholders. And it was just to work on fixing the defects with eligibility that were shown in the pattern details or insights or dashboards within DenialsIQ. So you can see how the dashboards and the insights and then your tracking and trending all are in the same tool, so you don't have to go to 10 different reports to get what you need. So we were able to reduce our eligibility denials by 16% and our coding denials by 14%. And that's over $2 million, which is kind of a big deal for any organization, or really any amount that you can save by preventing denials upstream, helping teach people what's their influence in the revenue cycle is really worth it. And so visibility turned into action can really save your organization money. And now we know it was more than just oil. You really need a tool to help drive your improvement and priorities for your organization. Other teams in my revenue cycle and outside the revenue cycle are more engaged. That visibility, sharing the dashboard. And something else we are really trying to do now is put together a provider dashboard so we can show them the impact of the coding and or operational challenges they may have and how that impacts the revenue cycle. And again, some of the trends we thought we had, some were much larger than we thought, and some were much smaller. Again, because we saw the authorization denials in our face all the time, we thought that was our biggest problem. And it turns out it wasn't. We had a bigger eligibility and documentation and coding problem, but we didn't know that before we had DenialsIQ. So with that, if you have questions for me, like Andrew said, please type them in at the end, and I'd be happy to share with my experience with you. But now I'm going to turn it over to Claire Wright at GE, and she's going going to give you a little demo of DenialsIQ.
Great, thanks, Lisa. Hi, everybody. Good afternoon, good morning. Thank you for letting me join today to give you some insight into our analytics solution, DenialsIQ. Before I get into that, first and foremost, I've been with GE for upwards of 13 years, all under the EDI umbrella. And I am agnostic in my efforts in the sense that I work with customers on a variety of platforms and practice management systems. And before we jump into the demo, I wanted to just highlight another case study that we've done at Orthopedic Institute. I worked very closely with them for upwards of a year. They are a DenialsIQ customer, and just like Lisa, they use Centricity Practice Solution. They were able to find very valuable outcomes using our analytic tools. So again, just as a reminder, DenialsIQ is really geared towards any customer using a variety of platforms, and we really are striving to make a very huge impact with those drivers and making sure that they have very valuable outcomes. So I'm going to go ahead and I'm going to actually jump into our demo database. So just give me a moment here while I share my screen. And just as a check, Lisa, are you able to see my DenialsIQ dashboard?
Yes, I am.
Perfect. Thank you very much. All right, so before we walk through the solution, I wanted to just set the stage here. Like Andrew said in the beginning, there are some moving pieces to this solution, one of which is we pull all the data from EDI data. So what does that mean to you? Well, we're pulling the data from your 835s, from your 837s, and we're really leveraging that information through a variety of platforms here, one of which is our dashboards. So when we log into our overview dashboard, this is really designed to give administrators some exact information about what's going on with their claim denials in order to make managerial decisions about people, whether or not you need additional training, processes, so workflow efficiencies, and then finally technology to improve that financial performance. DenialsIQ dashboard operates on a rolling 13-month period, in which case you are able to do a variety of filtering options to either minimize that time frame or expand it. So as it pertains to your denials and that very valuable EDI data, you can start to leverage and really work with the information in order to find that insight. So just to quickly take you through a little bit of a tour here with the overview dashboard, just as you will see in a moment with our other dashboards, we're able to basically mimic how your business is structured. And what I mean by that is if you're siloed by payer or perhaps you're siloed by provider, we can extract that data and really make it meaningful to your organization based on how you're structured and how you're really pulling together to work those denials. So as you can see here, we have an overview. However, we can see that the data is really presenting in a variety of those subcategories. So again, it's really perfect for a variety of audiences based on how your business is structured. So DenialsIQ, first and foremost, can help your organization discover information about your financial performance that then allows you to build insight around the DNA of your denials. Okay? So dashboards provide that 30,000-foot view of your organization and how it's performing financially. So really we're looking high level here, right? We want to see the information. We want to start to understand it. And so by discovering potential upticks and trends of where your organization is financially leaking, we can then fix the issue, but more importantly, remedy the issue long term. You can see here that there are a variety of ways to navigate your information, whether it be through the subcategories or the filtering options over here on the right. So as you saw, Lisa was able to uncover workflow inefficiencies that they didn't realize were impacting their staff, but in turn impacting their cash flow. So with DenialsIQ, they were able to see the information that led them to action and outcomes. So one of the ways in which they were able to do this was to investigate their categories dashboard. So I'm going to quickly just toggle over here. You can see that there's a variety of dashboards that you have access to at your fingertips. But for today, we're going to be looking specifically at this categories dashboard. So I'm going to click on that. Now, the categories dashboard presents information in a fashion that allows the customer to discover not only the simple stuff, right, what Lisa sort of alluded to, that low-lying fruit, but also those issues that perhaps were previously undetected through a manual process, right? So if you think about it, you're typically looking at this in a very manual way. And oftentimes, when we're dealing with manual processes, there's a lot of stuff we just don't know about. And the great thing about DenialsIQ is that we can actually evaluate that information and see it start to surface to the top. All right? So we can see here, you know, just as Lisa outlined in her presentation, that there were a lot of things that they knew about, right? So as an organization, you like to think that you have a fairly strong thumb on how you're performing. But also, there's a lot of stuff that perhaps they didn't know about. And that's really where these dashboards can start to help you navigate and really define what your next step is going to be. So sort of playing on that idea around eligibility, you know, Lisa had mentioned that she really thought that within her organization that prior auth was really a problem. But it turns out that, you know, even though she may have seen some eligibility denials, they didn't really fully understand how it was impacting their organization. So, you know, they're able to isolate the issue through discovering the information. So let's just take a look at this eligibility category. So what's nice about this in our dashboards, and this is really applicable to any of the dashboards that you're in, you're able to drill down and see some specifics around that particular category. So in the event that I wanted to export this data or really get it to the hands of the various stakeholders, just as Lisa did prior, I can click on that and I can actually extract that data. So not only am I able to see it sort of firsthand here within the solution, but I can extract it. So I can download it, I can pull in an image, or I can export it CSV file to an Excel program where I can do additional functionality. Maybe I want to create a pivot table or sort additionally so that I can really start to evaluate and start that reconciliation process. And really that lends to the idea of getting those quick fixes out the door. But more importantly, we want to make sure that we start to understand the reasoning behind the information, so that DNA, if you will. And this is really where the power of the algorithm comes into play. So let me just reset the stage here for a moment. Imagine that you're at your desk with an ever-growing pile of denials, or perhaps you have a task queue that continues to pile up. And the industry average, just as Andrew had mentioned, the cost of rework is upwards of about $25 per claim. So let's think about that, right? So you have your stack, you have your task queue. Each one of those claims could potentially cost your organization a substantial amount of money. And that dollar amount continues to increase, right? And it happens pretty quickly. Sure, we could take the time to manually address and attempt to define common factors between each ticket, right? So naturally, as humans, you know, you see a repetitive motion, or maybe you see some root cause factors that seem, you know, okay, I've got some issues over here in this particular location or with this doctor. We could start to piece those together, but it's unlikely that we have the time to really start to tie those pieces together as far as patterns and really decoding and evaluating on an analytical level. So instead, the algorithm can do that for you, which eliminates that daunting manual process. So let's jump over to Insights and see the algorithm in action. I'm going to toggle over here to our Insights. I'm going to set the stage here first and foremost. There's a variety of ways that we can view this data. Defaults to a weekly, but just like your dashboards, you can toggle between and sort of start to define the amount of time that you want in your viewing. In addition to that, you know, it does present in an all situations, so all patterns that pertain to that particular time frame. So our visualizations are a quick way to identify if there are any unexpected patterns in play. So following our eligibility discovery, I'm going to quickly toggle to that view and stay on track. So I'm going to come in here. We can see that there's a lot of patterns associated with a variety of categories, but I'm going to select eligibility, in which case our visualization will change as it pertains to that category. So really from here we can start to narrow in on that street level view, right? So, you know, our dashboards being our 30,000 foot view, our visualizations are sort of this 10,000 foot view. It's going to give me that visual cue. Okay, where's my problem? Where do I need to start to investigate? And then our pattern strengths, again, are really our street level view. This is really where the algorithm starts to be very powerful, right? So if you think back to that pile of denials and it's such a daunting task to try and figure out and categorize, and really, you know, that manual process of creating that trend is really done and through that algorithm. So we know right out of the gate that we can start to see those root cause factors and then, again, start to take action and produce some outcomes. So when we look at these, you know, we can look at the patterns and we can start to say, well, what are those root cause factors that are associated with my denials? You know, I know that I have X amount of dollars denying, or I may know that in this case I've got a substantial amount that's associated with eligibility. But why is this happening? We need to start to understand what those root cause factors are. So you can ask yourself, okay, so what are the root cause factors that build our patterns? And what are those commonalities between each of these denials? From here, how do we take action based on the findings of our street level view? And as we navigate through the DNA of our denials, we can really start to understand where we have a breakdown based on our root cause factors. So just like Lisa said, you know, it's not just about having a firm understanding of where the leak is, but how do we fix it? And most importantly, how do we prevent it from happening again, right? So really turning it into a proactive approach versus a reactive approach, right? Denials are a very inherently reactive thing in the revenue cycle. So we want to take that very valuable information. We want to have that 30,000 foot view of, all right, so I see some pitfalls in our financial performance, which is, you know, obviously going to help us navigate what our next step is. In which case we can see visually at 10,000 feet, all right, I need to make sure that I take a look at this particular pattern because I didn't know about that. I didn't understand that previously, you know, based on my root cause factors, that I had perhaps a certain location associated with a variety of doctors under a certain amount of coding errors, that I'm producing this type of denial, and it's impacting me not only by volume, and volume equals rework, but also the amount of money that's sort of sitting out there on the table, right? And as Andrew said, a lot of these denials, even if you're a top performer, are not even being addressed, right? Whether that is because you don't have the proper technologies in place, or perhaps there's a breakdown in your workflow, or maybe it's a training issue, you know. So this is a way for us to identify where do we need to pick up the pace and where do we need to bridge that gap in order to minimize the amount of rework cost that's accrued time over time, but also, inadvertently, we're going to increase that cash flow, right? So what's really powerful is that now we can understand why our organization is leaking. And furthermore, we can start to redefine our processes and identify whether or not we need new technologies or additional training. So DenialsIQ doesn't just discover denial patterns and trends. It allows you to unveil all aspects of your revenue cycle to help you perform more efficiently, which in turn increases your cash flow. All right, so I'm going to open it up to questions, which I believe are going to be facilitated by Andrew.
Great. Thank you so much, Claire. So we actually do have quite a few questions, everyone, so please stay on the line. But before we do that, we're going to go to a polling question. So this one's super complex, but if you'd like to get more information from G on the topic of DenialsIQ, please take 2 seconds or less to click the yes button. I'll give you a second to hone in on that and hopefully click the yes button, and we'll just formulate the questions. I've got about 4 of them lined up here, so thank you so much. Okay, if you haven't had a chance to click button, go ahead and do that. But let me direct the first question here. Let's see, who's it going to be? Claire, just because we're coming right off the demo, I'm going to point this one to you. How much customization is required to start using DenialsIQ?
There's no customization. Again, as a reminder, it's all EDI based. So that data that we leverage in the solution itself is pulled directly from the gateway. So we're leveraging your 835 and your 837 data. So if you're thinking you need additional hardware or any sort of tweaking to your own system, your PM system, that's entirely unnecessary. We leverage the data that we already have in-house.
Great, thank you.
Mm-hmm. All
right, Lisa, we've got one coming to you, and let's see. There are actually 2 or 3. So which one do I want to go with? Okay, here's a good one. Can you give the audience an example of how DenialsIQ has changed a workflow within your billing system?
Sure. So I would say, I gave the example of the eligibility, and that we actually had a large payer. It was a Blue Cross out of state, and we were getting a lot of eligibility denials on this Blue Cross out of state. And we didn't know that prior to the DenialsIQ information. But another example would be in our coding bucket, we had a lot of different denials, as you can imagine. There's a lot of different denial codes in there, but one of them was modifiers. And it's one of those things, I think, that your billing team is probably, if you don't have coders on your billing team, that you're working with an external coder to get an answer on. And so instead of having us go through them one by one, we handed them over to our coding team and said, are there edits that we're missing upstream? And it turns out there was actually quite a few. So with it turned out with one large payer in our area, we were missing a modifier on our claims, and so we got it fixed, and we created an edit upstream to make sure that our coders were fixing that prior to the claim going out the door.
Awesome. So actually, here's what I'm going to do for the next one, because you just answered it. Claire, why don't you and I tag team this? I'll take a swing at it, and then you can comment as well. Okay. The question is, are other DenialsIQ users using DenialsIQ data with payers? So obviously Lisa just answered that for us, but yes, in my experience, this is actually among sort of the first breakthroughs that customers have with DenialsIQ, and they realize that this is very complete data relative to the individual payers that they can then take back to the payer to have a much more meaningful conversation. One of our earliest customers during a working session with us said, I've been looking for a bigger stick to have this kind of a conversation with my payers, and this is the stick that I needed. So this is actually, you know, a really clear value prop in my mind for the application. But Claire, I'm not sure if you've had similar experience.
Absolutely. So, you know, it really lends to the notion around making sure that you have the data to back your story, right? So like you said, Andrew, you know, being able to say to your payer, hey, this is what I'm discovering. This is the type of tool that our customers can really bring very valuable information to some of those discussions. And creating that connection or a better connection between your organization and the payer, DenialsIQ can absolutely, you know, bridge that gap and provide those speaking points so that you can, you know, obviously establish a better relationship with them.
And Claire and Andrew, I can give an example of that.
Please, yeah, I was going to go to you anyway, so yeah, thank you.
Another large local carrier that we had a lot of issues with, one of them was that they were sending us a lot of documentation requests, and they didn't think they were. And so I was able to go into DenialsIQ and show them that 41% of their denials were for documentation. And they were really coming at it from an inpatient side, and I was able to show them that on the ambulatory side they were killing us with documentation requests. And so it was really helpful to have that data, kind of that driving power to say, yes, this is what you're doing because I have the data to show it.
Wow, that's great. Yeah.
Yeah. Now they haven't done much with it yet, but we're still working on it. But it was just great for them to kind of go back to them and say, "You've got this. This is our data showing that you're doing this." And it was a great dialogue, and we're still working on it. But again, having the information back to the payer is very powerful.
Perfect. Thank you for adding some more context to that question. Lisa, so another one for you. What would your advice be for somebody who's considering applying analytics to denials?
So you asked a little bit earlier about customization. So I think there is a little bit that you can do. So we had done a lot of work internally to categorize our denials in the workflows that our teams already had. So one of the things that was really powerful for us was really making sure that those aligned within DenialsIQ, and you have the ability to do so. And that way you can drive your team's workflows based off of that as well. And so it's not just about fixing processes, because we all know that the defects already occurred. So now how do I get it cleaned up as well as prevented? And so I really like using the analytics to not only fix the problems, but also to customize and help drive process flows for my billing team. So I can tell them, you know, we need to get caught up on all of these eligibility and coordination of benefit denials, because we're being told that that's our biggest denial. So we're going to try to fix it, but then we also need to clean it up. So that would be my thing, is if you really want to not only prevent denials from happening, but also to help drive your workflows for your team, this is a really great tool to do that.
Awesome. Thanks, Lisa. So Claire, another one for you. How long does it take to get up and running on DenialsIQ?
That's a great question. So the implementation process is very streamlined. As far as a technical component is concerned, because we are in essence just onboarding data that we already have, that process is pretty quick from contract to project lead assignment. I would say on average a couple of weeks. And then at that point, once we have the data onboarded, you are in essence live on DenialsIQ. In which case we have a project leader that is assigned to your group. And typically the implementation process, you meet on a weekly basis for upwards of about 4 weeks. So you meet once a week, and we make sure that you know, we're training your staff on the intricacies of the solution, how to filter and identify your data, but most importantly, how to have it adapt to your current workflow. So we really take a good look at your business and analyze how you're currently working, so that we can make sure that there's a good marriage between the two.
Great, thanks. So this is the last one that I have in the queue, but for anybody that wants to ask an additional question, please feel free. We're still here. Type it into the box on your screen, please. So Lisa, this question sounds like it's coming from somebody that has something on their mind, but it says, Lisa, do you see this as a tool that can help close revenue gaps?
Yes, I sure do. So as I've stated a few times, one of the things that you have to do to close some of those gaps is know where the gaps are. And if you don't know where your gaps are, then you can't fix them. So some of these items that I'm talking about, these are things we were writing off at the end of the year and not collecting on, and now we can. We understand what they are, and we have only begun, I feel, to close some of the gaps, but I know that the information that I have will continue to help close some of those gaps. Like the eligibility and driving that improvement, it took a lot, and it wasn't just me that saying it. It was the tool and the data driving that improvement. And so I absolutely think that it can close some of your gaps that you have. And as I said, we're just beginning, and I can't wait to see what else we can do with it.
Awesome. I think this sparked some some inspiration because there are a few more questions here. Okay, so there's one that I'm going to hold off on, and I'm going to come to you, Lisa. It's a question that I think dovetails nicely to the previous question, which is, how long did it take you to start seeing some of the outcomes that you talked about earlier in the presentation?
So some of the simple ones, only a matter of a couple months, and then some of the larger ones, close to a year. And that really is, you've got to drive some organizational change. It didn't happen overnight. There was no magic tool to say, we need to fix this today. You have to really, it's just like any organizational change, you've got to show the data, and you've got to help your teams understand what you're going through. And, this is a tough resource year for me. And so it was a really good opportunity to say, we have to stop these defects from happening because I can't always resource them. And we're just bleeding into the revenue cycle. And so it didn't happen overnight, like I said, but the ones that you can fix, because you'll see things in there that you can fix right away, right? That either you or your IS team can help you fix right away, or some of them are more organizational or behavioral change. And I really think for us, the eligibility and getting to do real-time eligibility and having better tools for our front-end team members is a bigger organizational change that has taken quite some time to have an effect on.
Great, thank you. So this question, last one in the queue, so if you have something on your mind, please enter it. Are there a range of service offerings in the event that we do not have the expertise to make organizational changes like Virginia Mason did? So this is really nicely pinned to how you ended your last answer, Lisa, and I'll take this one because it's a pretty easy one. The answer is yes. We do have a range of service offerings, both from an optimization of your revenue cycle perspective, as well as all the way through denials management. So we have services wrapped around DenialsIQ pretty much at every step of the way. That was a good question and an easy one to answer. Are there any last questions for the panelists before we bid you adieu for the afternoon? Okay. In that case, I will give everybody a couple of minutes to refill your coffee cups or whatever it may be before your next meeting. And thank you all very much for joining today's webinar. Thank you to both of our participants, especially Lisa Ness from Virginia Mason. your success is our success. So anytime we have the opportunity to promote that, we're thrilled to do it. And you will have the opportunity to hear from us at MGMA and Chug. So we hope that we have the opportunity to speak with you face-to-face at either one of those events. And with that, I will say good afternoon and thank you for attending the webinar.